from Fox 5 News. Good Day Atlanta at 8 a.m. starts now.
Welcome back at 8:36 now. We want to open your eyes to an important screening process that could make a major difference in your quality of life as we get older. It's glaucoma, and it's often referred to as the sneak thief of sight. Here with us this morning to explain, Dr. Anissa Threlkeld from Prevent Blindness, Georgia. Doctor, good morning. Pleasure to see you.
Good morning. Thank you.
You know, and I have to admit, I was misinformed. I thought glaucoma didn't become an issue until you were much older, maybe in your 70s or 80s, but at 40, we should start being concerned.
Yes, exactly. Especially our African-American population.
Okay.
It is the #1 cause of preventable blindness in the United States.
Wow.
2.3 million people have glaucoma. 2 million people don't even know they have it. The major populations that are at most risk include the African Americans from 40 on, Hispanics, and then the Caucasians. Caucasian disease tends to occur at 60 and above.
Okay.
So you're absolutely right about that. That understanding, but
right.
For some subgroups, it's extremely early.
Right. Okay, so let's talk a little bit about who may be even more at risk, because your family history may help you in determining if you're especially at risk.
Exactly. Family history, age, race, these are all the key features, because glaucoma is not diagnosable by a pressure check. Some people think, well, I went to the practitioner and got my air puff test and I was fine, but that is actually not something that rules out glaucoma.
Okay, let's talk about what it is. You brought along a little illustration here, and you're going to try to help us understand a little bit more about what glaucoma actually does and how it affects our sight.
Exactly. First of all, it's a complex group of disorders. There are some 42 different kinds, but what's in common among all of them is damage to the optic nerve in a characteristic fashion. This may occur with high eye pressure or normal eye pressure. That's why pressure cannot be part of the diagnosis. It's just a risk factor. In this cross-section of the eye, you see this is the cornea, the clear window of the eye. Here's the iris, the lens, which becomes a cataract. And then back here is the optic nerve or the eye nerve.
Oh, okay.
And this is where the problem occurs. So when you are seen by a practitioner and the eye is dilated, they see the nerve head on. It looks kind of like a donut with a hole in the middle.
Okay.
And I'd like to show you some examples of glaucomatous nerve damage.
Okay, let's take a look here. We have some pictures for you. And obviously, you can get the screenings at Prevent Blindness, but here's the, oh, there's the donut hole you were talking
exactly.
about. Oh, wow.
So it looks like a donut with a hole in the middle. The more cake, the better. In this case, actually, this nerve looks pretty good. There's a lot of good tissue there, but the key feature is a little hemorrhage. So this person was probably seen, pressure was normal, and then the physician or doctor looked at the back and found the hemorrhage. That is a sign of low pressure or normal pressure glaucoma. This is a further case where you see the hole is larger. There's less orange or less donut. That's advancing glaucoma. And then finally, this next picture is complete glaucoma. There is no vision in that patient's eye. It is completely damaged.
Oh my gosh. So what do we do
to prevent it?
To prevent it and to treat it, if you will.
Right. Well, the most important thing is early detection.
Okay.
And that is why I'm pressing the fact that don't feel that a pressure check has gotten you off the hook. You need, if you are especially in these subgroups of African American, Hispanic, and older Caucasians, you need an exam every 2 years, and not just a pressure check, but an evaluation of the nerve. Once that is identified, then we have marvelous ways of helping people maintain their vision for the rest of their life. Medicine, laser, and surgery.
Okay. So diabetics and nearsighted folks need to
right, those are also subgroups, yes.
Yes, they need to especially pay attention. Okay. All right, you heard it from the doctor. It's very important to get full glaucoma screening. For more information about Prevent Blindness Georgia, or if you have a question for Dr. Threlkeld at Marietta Eye Clinic, log on to myfoxatlanta.com, click on the Good Day tab. We'll have all the links. All right.